Hey, how's it going today? Chris Brown, Met Preservation Inc., coming to you live from the Hilton Garden Inn. As you can see the curtains back here. Got lots of nice comments about that on my last vlog. This is vlog number 2 today, and what I want to talk about is interoperability, and I guess more specifically, meaningful use 3. Those guidelines go into effect January of 2019, and interoperability is a big part of them. So, I spent the first 10 years of my life in retail, Walgreens, Walmart, all connected by satellites. Been that way since I think about 1995, which was when I originally started in the pharmacy realm. So when I came to a hospital after, spending the first 10 years of my career at these retail chains, it just kind of blew my mind how not connected hospitals are and how siloed they are, I guess is a better word for it. So the fact that hospitals are now coming along, or the government's actually coming along, I really think is a good thing, and I'm excited about it. And I think that's where your healthcare should be, and patients should have access to that. And your other doctors and other hospitals, if you're traveling, you should have access to those records. So I'm excited about the opportunity. It's not going to happen quickly. It will be a slow process, but it kind of amazes me that we're so far behind in healthcare. Even like banks, you think about how long they've been connected. I recently even heard that banks are using voice-activated technology, to where you can access your money. So definitely far ahead of us. In talking about these meaningful use criteria, I really want to focus more on the stuff that I kind of know about and understand, which, my background is pharmacy. So, standards is really a big thing I think about. And, you might say, well, there's nothing about standards in Meaningful Use 3. But if you look at the bigger picture and you start talking about CCDs, standards, do play a role. And so if you're one of those hospitals that haven't implemented these standards, whether it be directions, SIG codes, or routes, or even PRN reasons, I really believe that you should think about doing that. I know it's hard to believe that there's still some sites out there that haven't standardized this stuff, but there are. I've come across a few of them here lately, and so I got to think that there's others out there. And so you think about something about directions, and even e-prescribing. When you're discharging somebody from the hospital, and you're sending this information to retail pharmacies. If you have SIG codes that make sense to you and nobody else, then that's a problem. It's probably going to cause a delay in patient care, or it might even cause some kind of medication error. So really clean up those SIG codes. I was recently working for a site that had over 300 SIG codes in their dictionary. I mean, just overkill. I think we got that down to like maybe 110 or so. You can really optimize these dictionaries. The providers don't have to sift through all that stuff when they're e-prescribing, and it'll make a lot more sense when you send these prescriptions to retail pharmacies. I mentioned CCDs earlier, and part of Meaningful Use 3 is that you have to reconcile clinical info. And so in this clinical info right now, all that's going to be mandated, I believe, is the problem list, allergies, and the med list. And so when you think about reconciling, and if these CCDs don't map up to what you have in your system, then that's just that more of a manual process. So I really believe that standards come into play there as well. Also another big part of meaningful use is FHIR technology or APIs. And as these third parties start to make these APIs and healthcare information is interchangeable, those standards are going to play more of a major role and allow for easily mapping this data. So it's just a good thing to keep in mind. The last part of Meaningful Use 3 that I wanted to talk about was immunization reporting. If you haven't done this build yet in Meditech, it is a doozy, probably one of the toughest I've done personally. And part of interfacing with the immunization registry means that you have to be able to submit and receive data. And this data includes immunization schedules and histories. So If I've come across a site lately that just had a handful of this is actually clinics had a handful of items built out, uh, in their immunization dictionary, and that's another good point. If you're not on centralized immunizations yet, to achieve meaningful use 3 for Meditech, you need to be. So that's something you really need to look at, and that was a build that I was talking about being a doozy. But these schedules and histories, this clinic site only had a few immunizations built out, just the ones that they administered in their clinic. But if you really want to be able to submit and receive data, or really receive data from these registries, then you need to look at building out these historical immunizations, and maybe not just the ones that you carry, but I would definitely build out the ones that are required in your state for school, that have to accompany the child on their first day of school. So it's something you need to think about. Um, I I really like this topic of immunization reporting. I feel like it's a tough one, so there's a few more things I want to talk about as far as the centralized build goes, and I think that's probably going to be my next topic. So hopefully you'll stay tuned, or watch the next one if you're interested in that. And so with that, I will leave you today, and just want to say be kind, be careful, and always choose joy. Thanks.